Hi, welcome back to part 8 of Informed Consent with Jamille at Jamille Wellness Counseling. Hi, I'm Jamille. Okay. So this is still part of the experiential skills group training, and this part deals with just explains, explores how I use sound therapy, the voice, and sound baths as adjuncts to my counseling process. So here we go. These training groups will utilize different sound therapy modalities, including tingsas, which are bells, tuning forks, metal and crystal singing bowls, gongs, hung drums, rattles, and shakers. The voice will also be used as an instrument in chanting, singing, humming, and in different breath practices that affect the throat and voice, like ujjayi breath, which is ocean breath in yoga, and it's that kind of there's a little constriction at the back of the throat there. And it's great for getting the body into rest and digest, parasympathetic. So, collectively, the use of singing bowls, gongs, hung drums, and tingsas are commonly known as a sound bath. No bathing suit required, because the sound frequencies sort of are all around us. That's why it's called a bath, and it involves the participants simply assuming a comfortable position, usually lying supine, that's on your back, and listening to the various sounds. Care is made to use frequencies conducive to facilitating a grounding and or relaxed state, although researchers hold varying opinions on what that is exactly. So there are many studies on the efficaciousness of sound baths to help stimulate the parasympathetic nervous system, and most people find them relaxing and or enjoyable occasionally. Some people found the sound irritating, and the sound bath produces a paradoxical effect in and on the participants, so they get more agitated, not relaxed. Choice is always optional, and because there's an opportunity to process your experience at the end of the group, there can be important insights. Just normalizing that, and that it's all, it's all grist for the mill, as Yellen would say. He said anything that happens in therapy is all something that can be processed. So, and oftentimes the deep aversion to things are part of that core material that's implicitly held, right? There's no conscious awareness of, oh, the sound makes me feel this or whatever. There can be, right? But oftentimes it's the unconscious, and really people say the goal of therapy is to bring the unconscious conscious. So sound can do that. Yeah. Okay, and then just some nuts and bolts here. On average, the effects of a sound bath can typically last 12 to 24 hours, depending on the transition time to return to everyday waking activities. So if you have a bunch that you're doing after the sound bath, it may take you longer or shorter. You may feel more spaced out and disoriented, and so then you're not really um, really noticing those effects, or you're noticing maybe some negative effects because there wasn't time to kind of integrate and be with that state. So, yeah, so I always encourage my clients to not have anything planned after a sound bath that other than resting, drinking tea, journaling, relaxing, even processing with friends, but to not go right into doing. Yeah. There can be a deep release of blocked emotions that can cause dizziness, nausea, pain in certain areas of the body, and even headaches. These symptoms should dissipate overnight as the newly aligned energy integrates. So again, you can slow down and process the experience and whatever downloads you get. Be prepared to work with integration in the following days, weeks, or even months. Drink plenty of water before and after your sound bath session, and make sure to get plenty of rest. Hydrate, hydrate, hydrate after the sound bath. Water is life. So, yeah, I just want to give voice to the little sentence that says there can be a deep release of blocked emotions. So there can be crying, there can be anger, there can be joy, there can be fear, there can be happiness. So there can be a lot of these deeply held um, core emotions that manifest in different ways. So I always encourage my clients just to go with what's happening, let it flow through them. There's so much evidence that, like, even with an anxiety attack, the panic, if you just stay with it and really be with it, it'll pass in like 90 seconds. But if you don't, then you're pushing it into the tissues, and then you're increasing this sort of state of anxiety, this low level anxiety. So yeah, so just want to say that. And then some contraindications. So, because there's an abundance of caution that's used with sound baths, we're going to say anything that's implanted in the body or anything that can be sort of vibrated loose is going to be, buyer beware sort of situation, or participate at your own discretion. So, some of the commonly held conditions or situations where sound baths are sort of contraindicated: people with carotid stenosis or carotid arthrosclerosis. So this is the narrowing of the carotid arteries. So again, don't want to really break anything free and throw a clot, either pulmonary embolism or brain. So just of the abundance of caution, right? Um, Cardiac pacemakers or artificial heart valves or cardiac arrhythmias. Although oftentimes I would say with the arrhythmias, the sound baths can be relaxing and bring you into more of a normal sinus rhythm. So there's that. A stent or a shunt, deep brain stimulation device. People who have epilepsy or other seizure conditions, probably contraindicated. Also, recent surgery prior to suture removal, prior to full healing and closing of surgical scars, especially and including any metal in the face or jaw. So, of course, then there's the flip side of that, that sound baths, because they help shift us into parasympathetic, rest and digest, that they can increase healing time. So, obviously, if there's fresh sutures that can, kind of vibrate loose, we're just, again, in the abundance of caution here. So, and then finally, an embryo gestating in the first 12 weeks of pregnancy. We know that there's a lot of things that can happen in that first trimester. So, so we're really talking about, that first trimester. And then as, the pregnancy progresses, even it's at the mother's discretion. So, we talk about this intuitive capacity that we all have, and that, women have, and that mothers have, and fathers have it too. And yet, when we're carrying a fetus, when we're holding our baby inside, there is this maybe even a heightened sense of intuition. And so just honor whatever you're sensing or feeling about that. Is it a yes or a no if you're pregnant, if you're a woman pregnant and are asked to uh, experience a sound bath? Yeah. And so you may even lay on your side with that. So again, trauma informed, you can be in any shape you want. So that's what I go on to say. Being trauma informed means that in part emphasis is placed on giving choices, because many people, especially those seeking counseling, have had negative experiences with touch. I've created little wooden placards that are green on one side and red on the other. Will be given to everyone in the group to be utilized as another layer of consent before any touch happens. So green indicates okay for appropriate touch, red indicates do not touch. So even if the placard shows green size up, which would be okay to touch, verbal consent to touch will also be obtained prior to any contact. So if someone's having a hard time and they have a red, the person facilitating my group might ask them, would you like me to be with you? Would you like touch? And they may say no, and that's totally fine. Letting those experiences surface and flow through. We don't always need to stop them or even support them. We just need to be with them, which is hard to do initially at first, sure. And then, and conversely, if someone has a green and they've changed their mind, and so that's why that next layer of verbal consent. Oh, I see you have green. Is it still okay for touch? No, no, I don't need anything. So just know that. And then, as with traditional counseling, the use of integrative therapies in this group can start to elicit change, and group members may notice things getting worse as old patterns. In yoga, we call them samskaras, start to change. And some scaras are really like ruts of the physical and emotional and mental bodies and spiritual bodies, even. So, yeah, so as those new neuronal pathways start to be connected, it's less about destroying the old pathways and more about cultivating those new pathways. You may notice things start to become a little more challenging in your life as these new changes within start to affect your changes in your outer world. In yoga, we say, the outer mirrors the inner. And so I'll leave that one at that. So I just want to say normalize this normal part of the therapeutic process. And when the process is supported, group members may find improvement in their symptoms as well as improvement in their quality of life. So go on to say about how confidentiality in a group counseling setting cannot be guaranteed as each group member is not bound by any ethical or legal constraints that I or other counselors that are in that group work are bound to. So we ask that respect is given to the privacy of other group members' stories when outside of the group. So it's fine to share what your experience of the group is, and we encourage information to be limited in that way. So what that might look like would be I'm in a group and someone had a big emotional reaction, started crying or yelling or screaming. And I come home and I tell my husband, oh man, group was really alive. Someone had a big reaction. What I noticed inside of myself is that I became scared, guarded, wanted to leave, noticed that fight flight activation. So I'm not going to go into what that other person's story it was or why they had that big emotional reaction. I'm just going to share what effect it had on me. So I hope that makes sense. And we can, of course, explore this anymore, you know, uh, in therapy and in group therapy. We can talk about it more. I stress that additionally recording the session in any way is strictly prohibited. And I say because Jamille, me, I was still receiving supervision as an associate. My supervisor, Dr. Brian Duncan, may be privy to information discussed in the group during confidential supervision. So again, this will protect your anonymity. It will protect your confidentiality by keeping you anonymous. And so I might say a group member, a male group member, started having crosstalk with another male group member, and they started getting some heightened emotions, and I intervened in this way. What else could I have done, or that produced this result, and then I noticed I wanted to go this direction with the group or process in this way, and he might offer different ways to approach that. So again, just reinforcing or reiterating that I'm going to do my best to protect your confidentiality, even as I'm going through supervision. So, as associates, we have like 3,000 hours that we have to do under supervision, and and then even after supervision, after I'm fully licensed, peer support is so important as counselors, and so just know that you will always be protected. Yeah, your identity, and I'm sensitive to that. So, but anyway, so I hope that describes that part of of group. Thank you.